Trying something new. Trying something new.
Yeah, YouTube is an entirely different ball game. I'll tell you that.
Yeah, okay, I'm ready. I'm all involved today. I got my lab coat on, so maybe I can be more official for YouTube. All right.
Okay, we are in fact live on YouTube right now, so I believe we can
Well,
start.
okay, let's go. We can get started. I maybe we can yeah, go for it. Take it away. I'm ready
Okay.
to rock and roll.
Well, thank you firstly for having me, Dr. Isaacson. I really appreciate being here. I know a lot of people are coming in to hear you specifically answer some really important questions about brain health. So perhaps you can just reintroduce yourself to any new viewers.
Sure. So welcome everybody. My name's Dr. Richard Isaacson. I am a preventive neurologist, and if you haven't heard that term before, it's because the field of preventive neurology kind of doesn't exactly exist yet. And there are, a handful of us all around the country and a couple of us around the world. And our goal is to really try to get ahead of things. So when I trained, we were to treat diseases, and now really the goal is to try to prevent disease. And neurodegenerative disease, brain diseases really many of them start in the brain and body decades before the first symptom. For Alzheimer's, before the first symptom of memory loss. For Parkinson's, for the first symptom of tremors and shaking and slow movements. These diseases start literally decades before. So it's our goal to see not just people who are affected with neurodegenerative diseases like Alzheimer's, Parkinson's, Lewy body dementia, vascular cognitive impairment and dementia, but also see people at risk, see family members. Oftentimes we see whole families. We see the mom or the dad or the grandparent that was affected, and then we actually see the parents, we see the grandparents, we see all comers.
Okay, well, thank you for that. Yeah, I mean, that's amazing because I really think a lot of the medical industry really focuses on the treatment of it, but not
Mhm.
necessarily the prevention.
Yeah.
And I watched a lot of your content before today, and I mean, you say that you can develop dementia up to 30 years before you actually show any symptoms of memory loss. Is that true?
Oh yeah, and I think it's crazy because people think of, dementia or neurodegenerative disease as like an older person's disease, and certainly like people are at higher risk of developing symptoms when people are in their 60s, 70s, and 80s, and that's okay. Uh, but these diseases, if someone is in their 60s, started in their 30s, and some people do develop these symptoms of neurodegenerative disease in their 50s. And in that case, they developed the first silent, clinically, asymptomatic, no symptoms in their 20s and 30s. So I think people think of dementia or Alzheimer's or Lewy body or Parkinson's as an older person's disease. Not really. These are diseases of the younger age and midlife. And I think the thing that I've learned is there are risk factors, controllable, modifiable risk factors that anyone can do, whether a person is in their teens, their 20s, their 30s, 40s, 50s, 60s, 70s, 80s, or beyond. Anyone at any age can make a brain healthy behavior change and make brain healthy choices to reduce their risk of cognitive decline, protect themselves against dementia. And that's kind of why we do the work we do.
That's a really good answer. I think that takes me into the next question that I'm sourcing here from people who pre-submitted their questions, by the way.
Sure.
So they want to know if Alzheimer's can be stopped or reversed. Like, can we factually say that's possible?
Yeah, so I'm really cautious, and I have a saying, and our team kind of abides by a saying. We like to promise, not to overpromise. There are people that can do everything right and still get Alzheimer's disease. That's the tough part. I would say the good news or the reassuring news is based on the 2024 Lancet Commission report, which is Lancet is a big journal, a medical journal that's published in the United Kingdom and that's circulated around the world. Based on the 2024 publication, 45% of cases of dementia may be prevented if that person does everything right, and that's really the take home. So in terms of can a person at risk do something to get them off the road to Alzheimer's? Well, 45% of the time we can. Now, what if in that other 50% of the time? Well, we may not be able to prevent Alzheimer's entirely, but if we can slow it down, if we can delay it by a year, 2 years, 3 years, 5 years, 10 years or more, like that's amazing. That's a win. It's not perfect. We don't have all the answers, and no, we don't, unfortunately, have a cure. It's tough because when someone already has dementia, people want cures, and I'm fighting for it. Believe me, we're trying every single day. My team and I are fighting, but that person's had the disease for 30 years. So if there's someone out there in their 20s, 30s, 40s, 50s, 60s, 70s, 80s or beyond, and you don't have symptoms, that's a time that we can really do a lot. And if you do start having symptoms, talk to your doctor. Please talk to your doctor. There are things that we can do. There's FDA approved drugs. There's so many studies that we can do things. Can we reverse Alzheimer's disease? In my practice and in my perspective, I don't generally use the term reverse. Can we improve symptoms? Can we stabilize disease? Can we halt or delay progression? Those are things that I believe in our research and others, we've shown that that's the case. Can we reverse? I'm not really certain what reverse means, and I'd rather be conservative. Promise not to overpromise. Let's try to grab the bull by the horns. Let's slow down progression. Let's try to improve symptoms as we proved in our 2019 study. Let's try to improve blood proteins, which we can talk about later, amyloid and tau, these bad proteins. We've shown that in our research too recently. But reverse is not a word that I prefer to use just yet.
Hmm. Completely understandable. I think that really answers it. A lot of people are asking what the best treatment currently is in the market. I assume that's probably very subjective, though. You might have an objective answer to that.
Yeah, so first of all, in terms of disclosure, so I don't have any biases, disclosures. I don't take compensation or work for any drug companies or vitamin or supplement companies. Not that that's bad necessarily. It's just that's just I try to stay in my lane in terms of the science. So what I would say is there are several drugs that are approved by the FDA in the United States and also approved by a variety of the drug regulating agencies throughout the world, European Medicines Association, all over the place, that there are drugs that are FDA approved for the treatment, the symptomatic treatment of Alzheimer's disease. And there's two drugs, two different types. And I think that while these are not miracle drugs, they're not home runs or grand slams, I really believe that if a person has been diagnosed with Alzheimer's, using these drugs, in the right dose in the right patient, can really, be helpful. The other thing that I would say is there are now what we call disease modifying drugs. Disease modifying drugs are really important because disease modifying drugs, if used in the right patient at the right dose, you have to balance safety. They're also expensive. These are challenging things. I think disease modifying drugs may be able to really, move the needle. But disease modifying drugs are expensive. They're infusions that go in the vein. We need MRIs. It's more complicated. But yes, what I would say is there are several treatments now that are used for people that already have a diagnosis with Alzheimer's. But I think, most of our work and I think the biggest promise is towards prevention. That being said, if someone is out there listening that already has symptoms or already diagnosed, talk to your doctor. There are so many things a person can do from the drug perspective, potentially vitamins and supplements if your doctor says so, as well as lifestyle, making brain healthy lifestyle choices, exercise, nutrition, so much we can talk about. But I really believe that there are so many things a person can do to fight against Alzheimer's and dementia.
I mean, that's actually really encouraging to hear because a lot of the times, at least before I went into neuroscience, I just thought these things it just happens. There's not really anything you can do about it. As you're born, your genetics are already predetermined, and that's it. But when I found your research and everything you're talking about, it was really encouraging to see just how important exercise is, a lot of sleep, important diet, no stress. That's a hard one. I stress a lot, so I'm working on it. But are we likely to see a easy, accessible application in the future that I know you can't see every single patient in the world, and even though people would love to be able to, they don't really have access to resources. So, what would you recommend? I know you guys are working on some really cool stuff at the moment.
Yeah, so what I would say is the following. You know, anyone today can grab the bull by the horns and take control of their brain health. We have so many resources available now. When I started this, almost 20 years ago, I saw my first Alzheimer's prevention patient back in 2009. Those were the dark ages. You couldn't say the term Alzheimer's and prevention in the same sentence. You couldn't put those two words together. I used to get tomatoes thrown at me at conferences. Oh, dementia, yeah, it's not possible to do anything. There are no treatments. There is nothing you can do to prevent. Well, what I would say today is number one, talk to your doctor. Everyone out there that's worried about their brain health or want to reduce their risk should talk to their doctor. And everyone out there should know their numbers. Blood pressure, blood sugar, cholesterol. If you want to slam the brakes on cognitive decline, And if you want to reduce risk of Alzheimer's and dementia and other forms of neurodegenerative disease, know your numbers. Get not just normal numbers, get optimal numbers. Optimize your cholesterol. Make sure everyone knows their blood pressure. The top number, it's called the systolic. There was a research study that looked at what if a person's blood pressure, top number of 140, that's systolic, and bottom number over, say, 80. So 140 over 80s, which a lot of doctors think that that's normal. I don't think it is, and we'll talk about that in a second. They did a study. There was a study called the Sprint Mind Study. The Sprint Mind Study looked, is there a differential effect of blood pressure that's more optimized, meaning lower, 120s top number over 70s or below, so 120 over 70 or below, and they grouped that group and they compared it to a group of people that they followed over 3.5 years that the blood pressure was a little higher at 140s over 80s. And believe it or not, they stopped this research study early because the evidence was overwhelming that if you just lowered your blood pressure just a little bit, you could actually reduce your risk of developing the earliest symptomatic stage of Alzheimer's called mild cognitive impairment by 19%. Just that one thing, just by optimizing blood pressure. So to me, anyone out there today can know their numbers. You can go to a pharmacy and check your blood pressure. You can go to a pharmacy and buy a cuff. They're like $10 or $20 now, which is amazing. You can order one online. Everyone should know their numbers. If your blood pressure's high and your doctor has said, eat less salt, go exercise, but you've had less salt and you've been exercising and it's still high, talk to your doctor about ways to reduce your blood pressure. Cholesterol, the LDL cholesterol, that's the bad cholesterol. LDL cholesterol is bad. The higher the LDL, the worse the brain outcomes. The higher the triglycerides, the worse the brain outcomes. You can change your diet, and that may help, but sometimes people need medicines or supplements. And again, talk to your doctor. And finally, talk to your doctor about blood sugar. As the belly size gets larger, the memory center in the brain gets smaller. When someone has
Mm.
a larger, and especially this is especially the case in women that have visceral fat, meaning a collection of fat around their midsection, believe it or not, have a 39% higher likelihood of developing dementia. Talk to your doctor. We need to lose body fat, gain muscle mass, control our numbers, and do that. I think otherwise, if someone out there wants to learn more, and wants to take control of their brain health. And maybe it's hard to see your doctor's waiting list. It's hard to see doctors nowadays. Someone out there wants to go to a specialized clinic, but they have to travel or their insurance doesn't cover it. It's our goal to really put out free education, free support, free tools. And one of the tools that we've been really, really excited to work on, and this is a study, a clinical trial that we did a research study called Retain Your Brain. And the retainyourbrain.com is a free website where anyone can go today and sign up and take control of their brain health from the comfort of their own cell phone. It's like a virtual neurologist in your pocket. And what this software does is it aims to help a person manage their risk factors related to Alzheimer's disease and related dementia, and also helps that person learn about and support brain health. And anyone can sign up for free. Again, it's retainyourbrain.com, and the software will walk you through a risk assessment. Learn about what are that person's individual risk factors. There's so many things. There's cognitive games, there's learning, there's videos like this, and one day this video will be in that software too. That software will kind of be the key to unlock the door to the scalability or to the democratization of access to Alzheimer's education and prevention education. And I think, that's something that really excites me. So that's something that anyone can do today. And then the software will communicate with you. We'll have a conversation with you. We'll get to know you and help educate you on in terms of modifying these factors in life and try to optimize the score. And everyone gets this brain health habit optimization score. And it's kind of gamification is fun. The other thing I'd say is if there's people out there that want to learn more, I work at a foundation. Actually, I volunteer at a foundation. I volunteer at IND.org, Institute for Neurodegenerative Disease, where I direct the research program there. Anyone today can go to IND.org, go to the videos page or the learn page, and there are 50 separate videos, hours and hours and hours and hours of education about nutrition, about exercise, about this and that. There's so much out there. So if someone is watching on YouTube now and wants to watch more things on YouTube, you can go there. Or if you want to really, get even more empowered and really take a deeper dive, again, all access, free access, retainyourbrain.com has access and tools.
Amazing. I actually have somebody who asked a very specific question here. They say the US government is gathering personal data and sharing it. How safe is it to use Retain Your Brain software?
How safe is it? Well, that's a great question. So, we conducted a randomized controlled clinical trial. So, this is kind of the gold standard in science. Retain Your Brain was funded by the National Institutes of Health, got a grant, a research grant that my colleague Mark wrote back in. I think it was 20, it's right around COVID time. So it must have been, 2020, in the dark days of COVID. And we decided that actually our clinic closed because of COVID. Our clinic closed because no one was coming to the clinic. The world was shut down. It was only emergencies. And we use this opportunity to try to, create something that people can access from home. So we wrote this grant. And when you write a grant and you do a clinical research trial, we enrolled 988 people all around the United States. Actually, a subset of people actually also got blood draws. We sent an army of mobile phlebotomists out there to get blood, and we tracked people's blood over time. And as part of this, we had to assign a safety officer. We had to do things very in a very strict and compliant way when it comes to doing NIH-funded studies. The study was listed on clinicaltrials.gov. We submitted things to the FDA about this, something called the 513G. So anyway, long story short, we did track safety outcomes, and we presented these data at the 2025 American Academy of Neurology meeting, and we hope to present and publish this, the manuscript of the publication. But I would say that on the whole, using the software was safe. Of course, any various things can happen, and always, talk to your doctor and get approval to make any sort of lifestyle or medical or anything other change. But someone could be exercising and sprain an ankle, or someone could do this or that. But in terms of the safety of the software, the safety was quite good, and the software was well tolerated.
That's really good to hear. I think I have a pretty interesting question here that just popped up, which I find rather relevant too. I've seen you talk in the past about this regarding women and the estrogen factor when they hit perimenopause and menopause. And we have somebody here who's pretty concerned regarding that and what the stats are on women entering menopause and how they should counter that drop in estrogen.
Yeah, great question. And this is such a seminal question. And it's something that I really got dead wrong, a decade ago. When I was taught in medical school that 2 out of 3 brains affected by Alzheimer's were women's brains. And, I was taught that we didn't know why. And I said, well, aha, I have the reason. Women live longer than men. And there's a variety of reasons why. So I said, aha, if age is the #1 risk factor for Alzheimer's disease, then since women live longer than men, that's why women get Alzheimer's 2 out of 3 times versus men. I was wrong. Um, Women have individual specific risk factors that I believe, and we've spent like $10 million to study this. This was one of the key, goals and focus areas of our research at the Alzheimer's Prevention Clinic in New York City. And now we spend a ton of time and effort and money on this at ind.org. But the take home point here is women undergo a perimenopause. And during the perimenopause transition, whether a woman's in their mid to late 40s, early 50s, it varies quite a bit. There's this rapid drop of estrogen. Estrogen is a hormone. It's a hormone that women produce. That's a brain protective hormone, in my opinion. And what I've seen in our practice and what we've seen in our research studies, brain imaging studies and blood biomarker studies that we do, every day, we've seen that specific women that have a specific gene, especially, they're more at risk. I won't get into this too much right now, but it's called the ApoE gene, and it's the ApoE4 variant of the ApoE gene. And if a woman or a man has one or more copies of this 4, so a 3-4, a 4-4, for example, one from mom, one from dad, they're at a little bit higher risk for Alzheimer's disease. However, a woman with this ApoE4 variant of the ApoE gene is at even higher risk. And to me, what we saw in our research is that during that perimenopause transition, when boom, that estrogen drops, guess what goes up? That bad protein that called amyloid protein, builds up in the brain of a woman during that drop. And to me, in my clinical practice, and based on the available evidence I have today and the totality of that evidence, I believe that hormone replacement therapy, when when prescribed by a physician, and monitored closely, so you can track the hormones. In our research program, we track amyloid proteins, tau proteins, different proteins, as well as all the hormones. And when a woman is prescribed hormone replacement therapy, usually bioidentical hormones, a lot of times, again, can't make any medical recommendations. Talk to your GYN, your primary care doctor, your preventive health doctor. But when people, for example, a lot of women, we have a lot that take transdermal being a patch, bioidentical estrogen, and some of those women may usually go on progesterone either for part of their cycle or whole, and that's oral. And when women do this, we've seen in our practice, in our program, we just presented some of these data at the Alzheimer's Association meeting, that we actually see an attenuation or improvement of their brain biomarkers. And that's like super exciting. And that really hasn't exactly been shown before. In our research at Weill Cornell and New York Presbyterian, my colleagues actually showed that women that had hormone replacement therapy on board actually had healthier brains. Their brains were larger and their brains had less of that amyloid protein buildup. And that's like amazing. And that's really important. So there's a lot of controversy with hormone replacement therapy in women. What I could say is talk to your doctors, but this is something that I really feel passionate about.
I mean, that's really encouraging to know. That's definitely something I feel passionate about as well. So thank you for that. Now I have a question here in YouTube, which I think is pretty relevant. And a few people actually pre-submitted this. So one person says, my memory for names has been really bad since I was a teenager. And now sometimes I can't recall a word. Should I get tested? And then somebody else asked, how can you distinguish between normal age-related memory changes and early signs of Alzheimer's disease?
Yeah, these are great questions. And as we age, our brains age too. And our brains normally undergo certain changes where, for example, if a word is on the tip of your tongue, but you can remember it later, that's not usually a sign of Alzheimer's or early Alzheimer's. That's usually more of a sign of aging. Maybe the person is distracted, sleep deprived. There's lots of non-neurodegenerative, not bad stuff that can cause that. If someone notices that a word is on the tip of your tongue, and you remember it later, that could also be related to maybe some vascular changes in the brain, vascular risk factors like high blood pressure, high cholesterol, high blood sugar, or diabetes. But in general, words that are on the tip of your tongue that come back later may be also in line with just kind of the usual or expected changes that happen with the brain as we age. So that's one thing. I think the other part is, always talk to your doctor. If someone is not just having word finding difficulties, but, misplacing objects, forgetting appointments, getting lost while driving, having trouble at work, having trouble with finances, getting lost in conversations. I think to me, when someone has just the word finding difficulties, I'm a little less worried, but it's really the constellation of time, of signs. And if a person is not sleeping well and, not feeling great, but then they fix those things, they get their sleep in order and they start exercising and they do all the right things, and they're still having the cognitive glitches, that's when you want to talk to your doctor. That's what I would say. Then the next question, if my memory is moderately working, I have two small kids and they may have kept me up at night as well as our puppy, but that's a whole different discussion. The other question I believe was, what's the difference between, I think it was a dementia and something else. Is that what the question was, hopefully?
Yes.
Okay.
Basically, a normal age-related memory decline versus having active dementia.
Okay, great. So I'll try to give you my definition of the word dementia. So dementia to me is a progression or a loss of cognitive abilities, memory and thinking skills, where that person has declined so much that they can no longer take care of themselves. They can no longer pay their bills. They can no longer feed themselves. In some word, the term dementia it's I wouldn't want to call it an artificial word, but it's just a construct that explains that when the cognitive changes have progressed to the point where the person needs more help with things, everyday life, activities of daily living, that's when the person has progressed from, for example, a mild stage, mild cognitive impairment, which is, mild cognitive impairment, MCI, due to Alzheimer's, is the first symptomatic stage of Alzheimer's. When that gets worse, progresses over a few years, then the person may develop this construct called dementia. Same disease, just on a different continuum of worsening. As we age, as I said before, our brains age too, and age-related cognitive change, what is standard or expected as we age is it takes longer to learn something. It takes longer to learn something new. It may take longer for you to remember something, but it comes back to you. And and that's really key. I think the brain peaks, I think, at the age of 28. So anyone out there who's 28, enjoy it. Enjoy it while you got it, because it's going to change, and it's kind of gets harder. But that's kind of like when we peak in terms of like processing speed, learning ability, etc. And then there's a very, very slow decline over time. So what I would say is normal aging is just part of the thing, but dementia is not inevitable. Also, dementia is an umbrella term, meaning many different things can cause dementia. Alzheimer's is by far the most common form of dementia. There's vascular dementia, dementia with Lewy bodies. That's a really important thing to think about. There's frontotemporal dementia. There's dementia due to depression. There could be dementia due to vitamin deficiencies, which is less common, infectious diseases. But by far, when we talk about the word dementia, that's slowly progressive over many years. Common things happen commonly. Most common thing would be Alzheimer's disease.
All right, thank you for that. And I have a question that goes right into that from a YouTube user asking if lowering the blood pressure and the cholesterol affects the risk of Alzheimer's or just vascular dementia.
That's a great question. And I would say I am going to give you the best answer that I have based on my beliefs and what I've read. And this is kind of how I would say it. I'm not really certain, or I don't really think that having high blood pressure or having high cholesterol causes Alzheimer's. What I would say is it fast forwards cognitive decline and it really worsens Alzheimer's. About 30 to 35% of the time, a person is diagnosed with Alzheimer's disease in their brain. When they look at the brain tissues, you actually see vascular changes as well. So there's a lot of times when a person both has Alzheimer's dementia as well as vascular cognitive decline or vascular changes, and the two come together. So if we can slam the brakes on one, we can slam the brakes on the other. So I think the two work together. The one thing that wasn't mentioned was diabetes. Now, diabetes, I think, is a little trickier. Um, People with diabetes have twice the risk, two times the risk of Alzheimer's disease. Some people have even talked about diabetes as being like, or Alzheimer's disease as being like a diabetes, type 3 of the brain or something like that. And while, that's confusing and I'm not entirely sure which direction to go with that. What I would say is there's something funny about diabetes, blood sugar, having bad metabolism, slow metabolism. There's this hormone called insulin. Insulin is made by the pancreas. Insulin is secreted anytime someone has carbohydrates, sugars, especially if you have a soda that has high fructose corn syrup or lots of sugar, that insulin spikes to take down the sugar. And guess what happens? The pancreas gets harder and harder for it to do its job. The insulin, you can then become insulin resistant. You need more insulin, more insulin, more insulin to get that blood sugar down. And then that insulin causes brain inflammation, and brain inflammation fast forwards brain aging, and insulin itself, I believe, fast forwards amyloid deposition. The amyloid is that bad protein that builds up. So while I would say that, story here isn't entirely clear, I think different vascular risk factors have different individual effects on Alzheimer's risk.
Okay, I have two people here asking about the hormone replacement you were just talking about.
Sure.
One person asks that if they are already past perimenopause and in menopause, if it's too late for that. And somebody else pretty much asked the same question, saying they're a 66-year-old woman and they have one ApoE4 gene. Is it too late for hormone replacement therapy?
Okay, so this is a really important question. And the first thing that I would say about this is when a woman is past the perimenopause transition and has not been started on hormone replacement therapy, but has one or more copies of the ApoE4 variant or other reasons potentially to be at higher risk, this is a really important conversation that one needs to have with their doctor. And it's not a question that has, in my belief anyway, a clear answer. I think I'd say this 10, 15 years ago, if someone would have told me that today in 2025, I would be recommending in limited cases, in close collaboration, not me prescribing, but a GYN doctor, where we potentially start these hormone replacement therapy drugs at age 60 or higher, which we've now done in two cases, okay, in a research environment. So the caveats here is I have a treating clinician, we have an IRB approved, meaning a research ethics board approved research study, where we're looking at the biological and brain effects of starting hormone replacement therapy in a woman post perimenopause transition. 99.99% repeating percent of doctors out there probably would never even think about doing something like this. There are a handful of women that have come to see doctors, that we work with and that are enrolled in our research study, our research study where they sign a consent that we, can do this in a structured way where we can then, one day publish on this. But we currently have two women that did start hormone replacement therapy after the age of 60, one at the age of 60 and one at the age of 67. That's not something I ever thought I'd be saying. Is this being recorded? Saying on a live stream or being recorded, and it's something that we have not yet published. And I want to say very clearly, this is not something I'm advocating for, but it's something that I think science needs to do a better job at understanding this question for women. We have not done a good enough job. We need to, and we're trying. And I think we're probably a couple years away from figuring this out. But in our publication that I hope will come out either towards the end of the year or early in next year, hopefully we'll have at least some preliminary answers of this. In our cohort, meaning our research group, we have over about a dozen women or so that we're studying very carefully. And a dozen's not a lot, but we have 250 people in our research study. Research studies are very expensive. It's hard to do this. It's blood tests are expensive. It's logistically challenging. We have about a dozen women that we've been following. And what I could say that the data we presented at the Alzheimer's Association International Conference this past year in July was that this group of 12 women that started on hormone replacement therapy had improvements in their brain biomarkers of Alzheimer's risk, including amyloid protein and tau protein. This group of women ranged from age 42, which is on the earlier side, to 67. And, I think the jury's still out, and I don't think we have all the answers just yet.
Really nice answer. Thank you for going so in depth on that one. I don't hear a lot of people talking about it, which is why I keep asking. Okay, somebody asks, what are your goals for the future of the Retain Your Brain program?
Oh, great question. So, Retain Your Brain is software that is freely available, proven, studied in an NIH-funded clinical trial to, basically have an impact on risk. And the software was able to lower Alzheimer's risk. And, based on one type of, statistical analysis, using the software for 6 months, the free software at retainyourbrain.com lowered Alzheimer's risk by 6% in 6 months. And that is awesome. And it's just, available for free. And right now, you need a United States cell phone number. So one of those, I would say, tricky things. But we're going to be international one of these days. But where do I want to go with Retain Your Brain? Oh my. So number one, we applied for additional funding from the NIH, and unfortunately, we did not get that funding this past year. So we are, a lot of these changes are going to be, funding dependent. But we have so much planned and so much we want to do with the Retain Your Brain software. First of all, we want to make it globally accessible, so people that are not just based in the United States can get access. We want to try to have the software be able to link up with a network of doctors. By the way, there are so many doctors. This has been like amazing and like really rewarding that there are so many doctors that are using the software and saying, "Oh my gosh, I got to recommend this to my patients." Like we got an email today. I think his name was Brian, doctor. I'm forgetting what your last name is, but Doc, thank you for your feedback. Like we are getting feedback from doctors all the time saying, like this is what we need. Like doctors out there just don't have the time and the resources, and preventive healthcare is in America is not paid for. There's no reimbursement codes for Alzheimer's prevention. We live in a sick care system, not a healthcare system. So I want this software to go global. Maybe build a network of doctors. Include additional tests. Include expand. I want to expand our brain health report that you could print out and bring to your doctor. I think the software will just keep growing and growing, and it's available now. It's live. It's free. And download the beta version and stay in touch. And honestly, if you're out there listening and you're using the software, like number one, like let us know about your experience. We'd love to hear. And I'm going to drop a couple of links in the chat in a little bit. Maybe you can provide some feedback if you're a user. And also, we'd love before you tune off or whatever, I'm going to put some links in the chat, at least on the Zoom chat. Maybe you can handle the YouTube side of the chat. But if you want to evaluate, give us some feedback about this Q&A so we can make these sessions better for you. But yeah, we want to do a lot with the software. We want to expand it. How often should we do Q&As like this? We actually want to know from you what features and what we should build, and I'm really excited to learn and do that. And if you join the software, you can stay in touch with us to do that.
Awesome. Okay, I have to get to this question. So many people have asked it. This new lithium study that came out where
Yeah.
they claim lithium can do wonders. What is your opinion on this?
Okay, so I'm going to first multitask and I'm going to first put one of the survey links. Let's see, hosts and panelists. Where do I put this? I'm going to put one of the survey links that I was asked to put. I actually don't even know if I'm putting this in the right spot, but I um, don't actually know how to put the survey link in the chat, so I'm going to figure that out later. Let's ask the question about lithium, and maybe that was a stall tactic, so I could prep for answering this lithium question. Let me talk to you about lithium. So this is what I would say. There was a recent study that came out that was a very elegantly done, very high quality study that was done that looked at mouse models first, like animal models, and then proposed that maybe using a substance called lithium. Lithium, for example, lithium orotate is one that's kind of been in the news, and people have been texting and emailing me about. The story around lithium orotate has honestly been around for over a decade, and several of my earliest patients at the Alzheimer's prevention clinic self-started at low doses when it first hit the news, all that time ago. Now today, I have all these cool tools. I have blood biomarkers. Like I can't believe that today someone can come into the office. We can draw their blood, and I can, we're trying to develop what we like to call the cholesterol test for the brain. Now you go to your doctor, learn about HDL, LDL, triglycerides, you learn these things. Now we can look at amyloid, tau, NFL, GFAP, all these things. Anyway, why is this important? Back then, 10 years ago, when people were using lithium orotate, I had no way to track their blood biomarkers. I had no way to gauge any positive or potential negative effects on brain function and brain proteins. And also, when those patients were using it back then, and they were self-prescribing, I haven't personally recommended this just yet, but I actually didn't really see anything tangible that I could detect in their usual blood tests, their cholesterol tests, their metabolic tests, their cognitive testing. These things are really hard to study, like what dose, what brand, what this and that. I think what I would say first is, what do you do when you see a study like this and you get excited that this is the next new thing? My bias, and I'm conservative in this sense, but my bias is that I almost never believe a study like this without sufficient clinical data. The study was well done, no doubt. That being said, it's always a risk versus benefit ratio. It's a judgment call, and this is a supplement that if a person wants to take, number one, talk to your doctor. Let's always talk about that. And number two, if you get excited about lithium as being the big thing to potentially prevent Alzheimer's, and you're excited by that, but you're not exercising on a regular basis. You're not eating a Mediterranean style diet. You're not getting at least 7+ hours of sleep. You're a stress ball and you're not doing something to mitigate stress. You have high cholesterol, high blood sugar, and and high blood pressure. And you think you can take a magic little pill of lithium to prevent Alzheimer's. We're barking up the wrong tree. It's like a drop in the ocean, whatever that saying is. So what I would say is, these types of interventions, I'm not anti-supplement or pro-supplement. I'm not anti-vitamin, pro-vitamin, or anti-drug or pro-drug. I'm pro-evidence. And right now, I'm not anti-lithium. I'm not anti-lithium orotate as long as the doctor approves. But what I would say is, I've never proactively suggested it. I've also never pushed back when a patient wants to start it themselves. Going forward, what I'd love to do, and we already have a patient, I won't say her name, her first initial is P, and she's amazing. She decided on her own to start this. She already had her blood biomarkers in our freezer, and she's going to come back in 6 weeks, and we're going to repeat it, and we're going to use what we call these N of 1 studies in our research study to get some evidence. The other thing I would say is, let's take the other opinion. Could this do harm? I have a colleague I have many colleagues. Most of my colleagues are much, much smarter than me. What do they call the person that graduates last in their medical school class? Do you know, Tia?
I do not know.
Doctor.
Uh,
See, that's dorky neurologist humor. I'm sorry that you had. I'm sorry. This is being
no,
recorded?
I like that. That
Was
one
that
caught me
okay?
off
Okay,
guard.
great. I got like 9 of the same jokes, so that was one. The brain transplant joke will come later. Anyway, one of my very, very amazing, one of my actually easily top 3 of my favorite colleagues that I wish I could spend more time with and talk to, but Dr. Rudy Tanzi, he is amazing. He actually has changed like the way I think about a lot of things, and he's just been so gracious and just so I'm just so respectful of him. But he's he's educated me on this, and like what he would probably say, and I don't want to put words in his mouth actually, but what I would say is that he would say that if you block a specific something in a publication that Dr. Tanzi did, I think it's called like a GSK3 beta in his Alzheimer's and dish model, which is like really cool. If you block if you you can block tangles in response to amyloid, and this was published in Nature or something. But like lithium, when they did that, when they put it in the mix, and I hope I'm again last medical class doctor. It didn't work. Lithium didn't work. Their studies also didn't find other effects on these brain cell parts called microglia. The other caveat that I think he would say, and again, I don't want to put words into his mouth, but I'd say what I believe I've tried to learn from him. Maybe the doses that are potentially needed in mouse models, like maybe that would be harmful in humans, and like or we can't even get to that dose. So what I would say here is, this is a long answer because this story is complicated. But whether you take the basic science perspective or my clinical approach, I'm not sure that I'm jumping into trying lithium orotate. That being said, I'm not opposed as long as that person is doing everything else in their power to prevent Alzheimer's and cognitive decline through lifestyle and other medical changes that are already at their disposal and have a greater volume of evidence.
Thank you for that one. I mean, I have a really important question here, perhaps the most. A lot of people are asking, what does Rick Ross stand for on your lab coat?
Very absurd. See, this may have been a test. This may have been a test. Like I like what kind of cheap lab coat? They spelled my name wrong. Like what happened here? Like I don't know what happened. So I guess I could tell the story. So I haven't had a nickname. I used to work at the University of Miami, and my residents, my neurology trainees, they used to call me boss. Or Hefe, but that's whatever. So and then somehow it became Boss and Rick Ross Boss, and Richard Rick and Rick Ross Boss, and my entire house is decked out in Rick Ross things. I'm not even going to tell you what I have here. I also have Rick Ross's shoes. This is ridiculous, but he had this auction, and I don't know if I should be going into this because no one's going to take me seriously after this. But I have Rick Ross's Grateful Dead Crocs. I have his chalice. I own several of his T-shirts, and I'm going to stop there because Rick and I have his pillows. Maybach Music Group. I have those pillows in my living room. So I like Rick Ross, boss.
I like that. I like that a lot. I think it's a really cool lab coat. I'm just going to say it.
Okay. Thank you,
Subjectively at least.
boss.
I mean, yeah,
Boss.
boss. We can go back to the boring medical stuff now. Kidding. Nothing's boring about the brain. This is something.
Wait. And just I just want to just be just one thing. Boss
Yeah.
with two dollar signs. Just
Yeah.
yeah, two
Yeah.
dollars.
Yeah. No, not one. No, no.
Yeah,
That's one too little.
yeah, all good.
I understand. So last time you did not finish this one. So I'm
Okay.
just looping back to it. Uh, they're asking if there's a differential effect of lower dose of GLP-1s versus your regular dose.
Oh yeah. Okay, so I've gotten a lot of questions about this because, the GLP-1s, and just to backtrack, what is a GLP-1? A GLP-1 is a drug that's actually been around for 20 years. GLP-1s are basically drugs that used to be involved in oral form. They're drugs used for diabetes, and now there's this big thing because they're now weight loss drugs. So over the last five plus years or so, they've been now out there for weight loss, and they went from the oral form to the injectable form. And you've heard the names again. Nothing. I have no relationships with any of these companies, but the Wegovy's, the Ozempics, the Mounjaros, the Zepbounds, and these are GLP-1 drugs that you inject. Weight loss. They can help with sleep apnea. They can help with heart outcomes. There was a study that came out like yesterday. They can help with liver problems. These drugs are like amazing, and honestly, probably in the last decade or two, probably the most impressive drugs that I've seen. There's some injectable cholesterol drugs that are pretty good, and there's amazing cancer drugs that save lives. But I believe the GLP-1 drugs, when used, here we go, in the right person at the right dose and for the right duration of time, I think GLP-1s are amazing. There are actually research studies that should be published before the end of the year to see if the oral version of the GLP-1 can potentially slow decline or prevent or reduce risk for Alzheimer's, and hopefully those data published soon. But the injectable doses, the problem is that these injectable doses give a lot of people side effects. And when a doctor prescribes a drug, but that patient that they prescribe the drug to has side effects, sometimes you can lower the dose. But what if the first available dose that was studied by the FDA or studied by the company that's approved by the FDA, what if the doctor wants to use lower dose because they don't want to hurt their patient, right? So there's a lot of talk out there about getting the drug in a vial, and actually the drug companies, for example, Eli Lilly is one of the companies. They actually sell it in a vial and they sell it direct, so it's not compounded. This is the real stuff. And some doctors out there have like actually told patients to take a half of the vial or take a third of the vial or take zero point 0.5 milligrams instead of 2.5. And we have a lot of patients like that in our research cohort. Now, this is unpublished data, and this is data that while we have presented at a conference where we've presented the combination of regular dose GLP-1 versus microdose, and the way that we categorized it, microdose was the lowest available dose for that drug on the market or lower than that. So again, using like an injectable where you only drop, a third or a half of the drug. I have been told by our lab principal scientists that I should not be making conclusions based on the data set that we have. So that's the caveat. And I can also say that we do not have sufficient evidence to make anything firm in terms of conclusions. But what I will say is if I had to read the tea leaves, and if we had, another 20, 30, 40 people that were on, microdose, and we had another 20, 30, 40 people that had the regular dose, and we could compare them. If I had to say from the minimal amount of data we have now, I would say that there is a reasonable chance of certainty that microdosing GLP-1s may be protective on brain health, even not at higher doses. And the challenge with GLP-1s is at higher doses, aside from the stomach upset, when using these drugs for a long period of time, if someone is not eating sufficient protein, and if someone is not, exercising on a regular basis, and they're not monitoring their muscle mass, you can lose muscle mass. And I don't like when people lose muscle mass because you need muscle to basically maintain metabolic rate and burn blood sugar. So to me, it's all about it's not about losing weight. It's about losing body fat and gaining muscle mass. Like I like when people gain weight when it's muscle. So GLP-1s may have some negative side effects. And I think that while the jury is still out and there's going to be two randomized controlled trials that will publish before the end of the year that will assess the oral version. What I would say is if I had to shake that, now I'm dating myself, but shake that 8-ball, is the 8-ball even available anymore? Like shake the 8-ball. It's all signs are pointing to yes, that there may be some subtle brain protective effects of low or microdosing of GLP-1s, but talk to your doctor, not FDA approved, don't have sufficient data. We have sufficient data called epidemiological data that says that people that take these GLP-1s for decades have lower likelihood of developing dementia and Alzheimer's later. So that's interesting data, but it's not gold standard randomized controlled trial data, but we will have that data in the oral form anyway before the end of the year.
Okay. Wow. Great stuff.
You
I
asked for it. That's the best
I
I can do.
I know, I know. I learned a lot there. Geez, that's a very interesting factor I should be thinking about. I'm a little bit young, but still, I think now, as you said, it's important to build the brain because you can afford to lose a little bit more when you are older. So
Yep, exactly.
I will focus on that. I have somebody here who is worried about sleep,
Mm.
saying they easily fall asleep, but they can't stay asleep, and they're wondering how they should change that.
Yeah, so sleep is again, I've learned a lot over the last, 20-ish years, of this whole Alzheimer's journey. And sleep was another thing that I got wrong. I thought, and, I think it's medical school's fault. They teach you that like it's okay to be up all night and be on call and like tied to a pager. And I have like, two phones at all times and like, whatever. And that's like, okay, but it's okay to help patients, but it's also important to take care of yourself. And, mind over matter only gets you so long. And sleep is the time when a person needs to have the trash taken out in terms of the bad brain protein that build up in a person before they have symptoms of Alzheimer's disease. So, in brief, when you sleep, the type of sleep called deep sleep is like the most restorative, restful sleep. That's when the trash collectors come in. And, we've all heard of the bloodstream and we've heard of the lymphatic system, maybe. Lymphatic is like the part of the fluid in the body that has the white blood cells and fights infections. But many people out there have not heard of the glymphatic system. And the glymphatic system is where the trash gets taken out. So, for example, say you're doing everything right. You're eating a brain healthy diet. You're exercising on a regular basis, strength training, cardiovascular, doing all the things. Got your body fat in check and muscle mass. Okay, doing it all right. But you're burning the candle at both ends. You're sleeping 5 hours a night and you think that's okay. Guess what? It's not because exercise, maybe we can say it like it loosens up the amyloid, the bad proteins. But if you can't sleep and you can't get to the deep sleep and you don't get enough of it, then the trash doesn't get taken out. And all that amyloid you loosened up will stay in the brain and it doesn't get deposited out. And that's increasing risk for Alzheimer's. And that's what we don't want. So sleep is really critical. What I would say about sleep is we need to make a plan for sleep. I'll give you an example. So I signed up. I was one of the first. I wasn't the first. I was upset about that. To be one of the first beta testers of the RetainYourBrain.com free software, and I signed up on that Monday morning, like 5 minutes late, I guess, and a bunch of people joined before me, and I got into this routine. The software told me that I needed to sleep more. Software is smart. I answered a questionnaire. It took 10 minutes, and it said, Isaacson, boss, sorry, boss, which may or may not be my name in the software, $2 signs, basically said you need to sleep more and you need to make a plan for sleep. And the routine, the brain healthy habit that was really suggested to me was put electronics to bed. And that's actually what I did. I'm still getting reminders every night at 9:30. It says, power down the electronics. And like, honestly, most nights I do. I try to turn off my phone, and then by 10 o'clock, like I can kind of get ready for bed, and that way I don't have a light shining in my stick with the phone. I make a plan for sleep. I start a wind down process. I really think that if you make a plan for sleep, the more time you spend in bed, the more time you sleep. Like that's an easy one. Getting quality sleep is hard. Don't drink coffee like before bed, right? Actually, don't even drink coffee in the afternoon. The new brain healthy routine that I'm in that I just adopted, I think 2 days ago, is don't drink coffee after 1 p.m. I think that was my brain healthy routine. Someone can correct me if I forget what the name of that routine is, but that's what it is. So I have this coffee here, but it's empty and it's from like 11:30. So today I did not make my afternoon coffee. So maybe that's why I'm dragging today, but I'm doing it. And if a person drinks coffee at 1 p.m., half of that amount of caffeine is still in the body at 6 or 7 p.m. Oh, wait a minute. What are you drinking? What are you drinking there?
Nothing, nothing.
Neuroscientist, Tia.
It's fine.
It's
I go to bed at
You go to
3
bed
a.m.
late. Yeah, you go
It's
to bed late. And
definitely not correlated.
we can talk about chronotypes at some point, which is people that go to bed at different times, because you're definitely the late night chronotype kind of gal. I can
Yeah,
tell. I can
guilty, guilty.
guilty as charged. But my empty coffee cup here would not have been empty a week ago if I was not in my retain your brain. Forgetting the name of it, but don't drink coffee after 1 p.m. routine. So, believe it or not, caffeine sticks around the half-life, half of that caffeine still around like 4, 5, 6 hours later, depending on a person's genetics. And if you have a coffee at 2 p.m., at 8 p.m., you still got half the caffeine. And like, that's not good for you if you're trying to wind down. So make a plan for sleep. Restorative sleep is key. For example, can't exercise in the afternoons or evenings. It messes up my sleep. I get too wired. To me, I exercise in the mornings. Find that individual rhythm. I wear a tracker, nothing to just, no relationships with the Whoop strap. I have a Garmin to, help with my whatever. And I track all this stuff. And I've learned that the later I drink coffee, the worse my sleep is. And for a lot of people out there, if you think that alcohol is good because it can make you fall asleep, think again. Alcohol is really bad because, yep, it makes you fall asleep, but the quality of sleep that you get with alcohol on board is very bad. One drink with an early dinner, say 4 or 5 p.m., 6 p.m. Most people don't eat that early, but I live in South Florida, a lot of early bird specials down here. We have a drink of alcohol with a larger meal to slow down digestion and to kind of get other stuff in the mix. But if you have 2 or 3 glasses of wine on an empty stomach at 10 p.m. and then you pass out and you fall asleep and you're like, oh, great. That was good. No, it's not going to be restorative sleep. You're not going to be recovered. Your heart rate's going to be higher in the morning. You're going to be dehydrated. The toxins aren't going to have the time to leave. So, there are so many things to learn about sleep. I could talk ad nauseum, but Retain Your Brain is actually teaching me things as we speak.
That's great. Wow, very interesting. That's going to make me rethink coffee. I should get my chronotypes tested actually. That sounds like a very interesting thing to do. To see what affects me personally. Yeah, individual research. A lot of people here are asking me, how can they actually find a doctor or a neurologist that is capable of providing them with these biomarker tests or potentially giving them GLPs? I
Yeah.
assume you're going to say just about every doctor should be qualified, but perhaps that's not the
Mhm.
question answered.
Yeah, this is a painful one, and it's hard. You know, we're really trying to build a network of like-minded doc. And honestly, it's amazing. I mean, there are so many doctors that reach out and really want to do more, and you know, we try to make as much time available as possible. It's like it's really hard. You know, it's hard to train new doctors and share resources, but you know, we have resources for doctors, and we're trying. But and the moral of the story is, I would say the first thing anyone should do, you know, is talk to their doctor. If your doctor has 15 minutes to see you and they have to deal with the heart, the lungs, the liver, the feet, the head, like they just are not going to have much time for brain health. And it's not the doctor's fault per se, it's just the system's fault. We're a sick care system, not a healthcare system. So number one, try to talk to your doctor, try to make an extra appointment. You know, retainyourbrain.com, the Retain Your Brain software that's available for free, is a way that we're trying to democratize access to education. It's not a replacement for a doctor, and I don't want to say that, but in the future, it's really our goal to take this software and truly add features that, and again, if you use the software and you have an idea for a feature, please let us know. Let us know. We'll add it. I hope one day you'll be able to access a healthcare practitioner, healthcare provider, doctor, nurse practitioner, PA, whatever it takes through the software. Like one day, I hope we're going to get there. You know, the other aspect that I think a person can do aside from, you know, grabbing the bull by the horns, learning as much as you can, ind.org. We have a lot of resources, free resources and education about brain health. If you really want to see a doctor, maybe try to find a preventive health doctor, a preventive minded doctor, preventive cardiologists do a lot of this stuff. What I would say also with the brain blood tests, there's it's a challenge right now to get a brain blood test that I believe is accurate, because there's a lot of like confusing things with these tests. Some of these tests are really good when a person has symptoms. The doctor thinks they have Alzheimer's, but you want to use the blood test to increase the chances to the suggestion that it's a screening test. Do they have Alzheimer's? And then yes, if it's positive, then you get a PET scan or a spinal tap. The website that I'm recommending that we're trying to work on to try to develop this cholesterol test for the brain. If you go to alzlabs.org, 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 we're trying to again democratize access, offer labs, screening labs, brain health labs at cost. We're just trying to get people access. You pay a fee that basically pays for the processing and the buying of the assays and the person to run the machine. And, you know, that's our goal. We're a mission-driven organization, and allslabs.org. We're not really ready for prime time yet, but the demand is there. Just, you know, send in your email address, allslabs.org. And if you want to learn about blood tests, we'll keep you posted. When it's available in your area, we'll keep you posted. We're working on it, but it's going to be a little bit more time. What I would say is, if you haven't found the right doctor yet, keep searching. And one day, I hope that in this Retain Your Brain software, we're going to have a list. We're going to have a map, and you're going to click, and you're going to be able to see a doctor. Maybe even schedule an appointment from the app. The app can then, you know, send over a brain health report of how you're doing in the software, and the software will be an extension of your relationship with the doctor. The doctor can order the blood test, you know, send them whatever. We can process them. Cholesterol tests for the brain. I hope that within the coming year, things are different. Right now, we're walking before we can run.
That's awesome. I'm really looking forward to that. Geez. We have a question here asking, so we know the APOE4 gene is not a good one to have when it comes to dementia. What are the other genes that they should know about that isn't good to have for these things?
Sure, great question. So I think I'm actually going to say, I'll step back and I'll say I don't know that I fully agree with the person that asked the question. Respectfully, carefully,
Mm,
cautiously disagree that having one or more copies of the APOE4 variant is like what I would characterize as bad, right?
mm,
Genes are not our destiny. We can win the tug of war against our genes. And genes, one gene, or even multiple genes, is just one of multiple parts of a very complicated equation. There's a term that's called epigenetics. Okay. Epigenetics means the impact of the person's environment, environment, lifestyle choices, environmental exposures, pesticides, whatever it is, lifestyle, exercise, um, cognitive engagement, learning new things, the impact of lifestyle and lifestyle factors, medical factors on genetics. So, for example, if someone smokes and has a gene that increases risk of cancer, lung cancer, if they smoke, they get lung cancer. Ta-da. Epigenetics, interaction between the tobacco, the smoke, and the gene causes cancer. There are other people that'll never smoke and get cancer because that gene did it. But that gene that did it with cancer, that's not ApoE4. There are the 1% of cases or less of Alzheimer's disease are caused by a person that has a gene that definitively causes the disease. And that's so uncommon. I've seen like 2 or 3 cases in the last 5 years. Yes, it happens and it's terrible. And we're working really hard to try to help people like that. But just because you have a gene, genes are not our destiny. But if you have 2 copies of the ApoE4 variant and you're at higher risk, you better exercise on a regular basis. You better make sure that you're eating fatty fish, uh, wild salmon, sardines, albacore tuna, maybe potentially if your doctor says, okay, taking an omega-3 fatty acid supplement. Smoking plus ApoE44, really bad. Alcohol plus ApoE44, really bad. And it's the same thing. It's the interaction between lifestyle behaviors. If you have 1 copy of the E4 variant, similar, please follow a Mediterranean style diet. Please eat fatty fish. Please exercise. Please get your cholesterol in order. Please modify your whatever, because there's an interaction. So while I don't necessarily think ApoE4 is bad, I think it's important to know, because then you can get ahead of things. And if you have that gene, you can do A, B, and C things and retain your brain. We have lessons on this on ind.org. We have education on this. I've talked about this a lot, but I'm not super worried about ApoE44 or 3,4, but I'm only not worried if the person is taking control of their brain health and actively doing something. So let me just say that it does increase your risk. I'm not trying to sugarcoat, but it's not, it's not inevitable. Ooh, what are the other genes? Honestly, sure, there are other genes that are related to Alzheimer's risk, but they're just not very common to study as much and to really to order commercially. I can talk about BIN1 and I can talk about, Tom 40 and I can talk about like and Serapina and like I could talk about so many different genes that I'm like interested in because I just read a paper on it or something like that. Sorrel1, for example, like that's a really important gene, especially in certain populations. But those genes aren't available commercially. You can't like go order them or take them. And then if you get the gene result, like what are you going to do about it? So to me, ApoE is really the main one we focus on. And I'd rather talk more about lifestyle and being proactive rather than thinking that, our destiny is uncontrollable.
Mm. Speaking of things you can control, olive oil, is that something we should be taking?
Oh, yeah. So, we need to bathe the brain with brain healthy fats. And brain healthy fats, to me, are really critical because, there's good fats and bad fats, good carbs and bad carbs. You got to know the difference. And the brain cells need fat. Okay, the brain needs fat. Saturated fats and trans fats, like, and I like ice cream, it's a problem, but like too much ice cream, like there's a lot of hidden trans fats, and that's just bad for everything, cardiovascular health and brain health. When it comes to healthy fats, avocados, extra virgin olive oil, at least 2 tablespoons of olive oil every day. Olive oil actually has direct anti-tau effects. Tau is that one of the 2 main proteins that build up in the brain of a person with Alzheimer's. Extra virgin olive oil, it can help with cholesterol. It can help with brain health. It can help with so many things. Honestly, I try to put it on like everything. We always have a supply. The key also is you have to make sure to get the real stuff. 60% in one study of olive oil that was available in the supermarket was fake. That's not very good. And or adulterated, meaning not fresh and not really pure. So, there are good types of olive oil, bad. Read the reviews, and I think olive oil is one of the most healthy things a person can do for their brain health. Tia, I have a quick question. Could you, we have a survey that I
Mhm.
think we were going to share. I'm not sure if you have that link, but I can't share anything because I can't figure out what to do with this thing. So, but if you could share that survey link, if you're out there and you've been listening, we have hundreds of people here in this one Zoom and another thing and YouTube. We have like so many people coming in and so many questions. My head is spinning. So Tia, by the way, thank you so much for moderating. And this has been like a blast. We still have a few minutes left, but you're awesome. And just thank you so much for doing this. I also want to just thank you. When you share the survey, give us your feedback. We'll try to make these better. I will get better jokes. I promise. I will change the lab coat. If you think I should change the lab coat, I'll get a haircut, whatever you think. But Tia, I just want to thank you specifically. Anyone with a brain is at risk of Alzheimer's. And, we have done a good job at accessing and reaching people age 50 and up. And in our research study basically, you know, showed definitively a retainer brain software that people age 53 and up were able to reduce their risk. But we really haven't done a good enough job at accessing people in their 20s and 30s and even their 40s. So I think you have an audience that can really make incremental changes now to, probably and possibly be the best situated of any generation to get them off the road of Alzheimer's. I think the dictionary just came out with a new word, generation alpha, with people that were born up through 2024. And like whether it's generation alpha or I don't even know what the next generation is, but if we can adopt brain healthy habits in our like teens, 20s, and 30s and beyond, we're going to get ourselves off the road, and we're not going to have to worry about a cure because we're going to, be able to have agency. And by the time a cure comes, Alzheimer's will be a thing of the past. So just thank you for that. I really appreciate it. And we definitely have a few more minutes for questions. The Q&A survey is now in the chat, in the Zoom chat. Thanks for sending that. And anyway, you're the moderator. You can take over. You can take back over now. Sorry for
Of course, of course. Yeah, I sent the survey in the YouTube chat as well. So guys, please go check it out. We would appreciate your feedback. And thanks for having me, Dr. Isaacson. I really appreciate it. It's really cool figuring out what people under the age of 40, 30 can actually do because I had no idea that it started so early. So now I'm focusing on exercising, eating healthier,
Mhm.
working on the stress. We're getting there. We'll see.
Yeah.
But I think we have like a minute or so left. You said you had another joke for me, and I'm kind of curious what that entails.
Oh, what jokes do I have? Well, the brain transplant joke is a good one. I have a brain. We're running a sale. We're buy one get one at half off. I don't know if you're interested. If you know anyone that's in the market hold on, wait. We have one. We have a new one. Price is dropping. Hold on 1 second. For just 89.95, we got beautiful. Look at the cerebellum. The cerebellum. We have actually, this is the temporal lobe. This is where the memory center in the brain is. This is where actually I'm moving my arm, my left arm, and actually that's the right part of the brain. This is amazing, and you can take this home. In fact, if you want, you can try it on. We have there you go. We got
Oh,
left. We
geez,
got right.
that sells it. That
There we go.
sells it right there.
There we go. Excellent. I'm gonna I guess we should probably end now because that was
Yeah,
ridiculous. And you asked
mhm.
for it though. You asked for it.
I
Sure.
I appreciate that. I mean, previously, Warren, I'm gonna stop the stream before anybody puts in any bids because personally, I'd like to do the highest bid and take it for
Excellent.
myself if you don't
Awesome.
mind.
Yep. It's yours. Thanks,
Okay.
everybody. Thanks for watching.
Thank you so much. Thanks, guys. See you again in a week from now.
Okay. See you then. Thanks. Bye bye.